Hey everybody, I'm going to show you how to get into the SimChart assignments. So I'm going to view as a student. Okay, so under simulations and the Mary C. Find Me assignment, that's where you'll go and you'll navigate around to find all of the items on the little Find Me document. Do not go into practice assignments. Okay? And when the Find Me assignment says start simulation, just start simulation. No pre-sim, but start simulation. Now, for the case study that you've been given, you're going to open My Clinicals, you're going to open the SimChart assignment, and then you're going to click on your class. Clicking on it here. Keep clicking until you access the simulation. Now, I'm going into this because I have already entered my avatar, my name, my age, provider, all the provider information. Once you already start, it saves what you've done and doesn't let you start a whole new SimChart, so I was not able to show you from scratch. But once you've entered your pre-information and you've entered your code status, if you don't remember how to do that and how to submit order, come see me. You're going to go into Patient Charting, System Assessment. Think of these as file folders, and then you can click and it'll open up. So you start with the top of your rubric, and it starts with cardiovascular assessment. Never put no assessment required unless there's truly no assessment required. But you're always going to have a cardiovascular assessment. If it's on your rubric, don't put no assessment required unless it's something like IV and your patient doesn't have an IV, or if it's something like drains and tubes and your patient doesn't have a drain or tube, then you can put no. But when it's an assessment, you always need to do it. So under cardiovascular, it's going to say, are there pulses? And you mark whatever they are. If you check the carotid pulses, you need to mark what they are. Are they normal? Are they bounding, not palpable? Most people just do radial and pedal. You can do however many pulses you want because it'll show up on the instructor sheet when we look to grade. So pulses, then it's going to ask you for edema. You mark whether there's none or whether there is edema. It's going to ask you about tissue perfusion. If their extremities are all warm, you're going to put that. Then it'll ask you about cap refill. This particular rubric doesn't ask anything else, so you're finished. So you go down and you save that data, and then go to the next section. Okay, so you'll see. Now it goes to respiratory, so you just go down all the assessments. Special precautions, isolation, only if that's on your rubric, enter it. So enter everything on your rubric in the assessment section. Okay, the next section that we're going to go to is preclinical manager. Preclinical manager, we start with diagnoses. This is very important. You choose your primary diagnosis, why they're in the hospital. If somebody has about 8 different diagnoses, choose the primary one. If you think you might need to choose a secondary diagnosis, ask your clinical instructor. Uh-oh, something's happening here. I don't know what I just did. Okay, so sorry about that. So choose your primary diagnosis, put it as primary, and then write your patho about it. Write what you researched. What is the patho for your pneumonia? Pneumonia is an infection in the lungs, so maybe you had to reference that from your Potter and Perry books, so you would put a little citation, Potter and Perry, 2011, or whatever it is. So you would put that after your reference. If you quote something, put it in quotes. Pretend like you're writing a paper in here. But you're only going to put a paragraph or two. Some things might only be a few sentences. If it's a UTI and you're having to research what a UTI is because you don't know how to you don't know what it is, then you need to reference that. Something in this entire section, pathotherapeutic current health problems, requires a some type of cited reference. And this is all you have to do. You can put page number if you want to, but you need to put this in APA format. So put your patho. A higher level function would be my patient had a hip fracture. A hip fracture is when this happens, blah, 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 cite it, and then link it to your patient somehow. My patient obtained this injury falling down the steps of his house in the snow, or because he had Parkinson's and he was unsteady on his feet and he didn't have his walker with him. Link it to your patient. Therapeutic regimen is what's going on to treat that patient. It could be they're on 2 different antibiotics and they're getting respiratory treatments and they have physical therapy coming. Whatever their therapeutic regimen is, try to write in complete sentences. You can also reference this. There may be a book standard for therapeutic regimen, but your patient is on something different. So write why they're on something different, why they maybe can't take the standard of treatment that's normally given to patients. Maybe they're allergic or whatever. Write why, link it to your patient. Again, this should only be about a paragraph, maybe just a few sentences. Writing complete sentences. Current health problems, that would be their comorbidities. They might be blind, they might have Parkinson's disease, but their primary reason for being in the hospital is because they fractured their hip. Related functional changes is something that students have trouble with. They never seem to understand what this means. So I hope that you guys are the first class that's different. Related functional changes are, what is this illness doing for this patient? Do they have pneumonia and they are so weak that they can't bathe themselves? That's a functional change. Do they have pneumonia and they are confused because they are so sick with this infection that they're not perfusing their brain? So their functional change is that they're confused or they need help bathing. Does that make sense? I hope that makes sense. You're not going to be able to answer me, but so fill this in to the best of your ability. Each section should be a few sentences to a few paragraphs, nothing more. And then we're going to go to the care plan section. So, in each section you save. So I'm just trying to get to the care plan section because I didn't say that it doesn't want me to go on. I didn't enter all the information. It doesn't want me to go on. Now it'll let me go. So the care plan section, you can choose your diagnosis here. Oops, I don't want to do that one. Do access. You can choose your diagnosis and it will populate some care plans. Some of them are going to be relevant and some of them are silly. Don't just click care plans in here because some of them don't make sense and your clinical instructors will know that. So you can select your nursing diagnosis. Mine's going to be pain. It's going to be an actual nursing diagnosis. And you go through, and they're related to is why, related to medical diagnosis, as evidenced by, remember this section is what you see, as evidenced by wound, or pain, or just keep adding the as evidenced by. I'm making stuff up too. So you're going to add as much as you need to. If you need to add anything else, you see how it just continues to list them. Okay? Expected outcome. This needs to be a measurable time frame. Abscess will be cleared up by the time they leave the hospital. So their outcome is it'll be gone by discharge. That's their measurable time frame. Or it could be by the end of my shift. They'll say they don't have pain by the end of my shift. Then you're going to go into interventions. And you're going to write your interventions. I will assess pain. And then you have to write rationale. Now in the care plan section, you have to reference something as well. And one wonderful thing to reference is rationale. Why would you want to assess their pain? because the book says so. And then you would reference this with your Potter and Perry, right? Just like you're writing a paper. So write your rationale in there. Now, for most of the SimCharts, you have to have 4 different interventions. So I'm going to assess pain. I'm going to administer pain meds. So see how I'm adding that, and then it gives me a space for rationale. Then I'm going to distract the patient, right? So I'm going to do all these things. Whoops. Let's see, administer pain. Okay, my distract didn't go in because I'm rushing to try to get this under 10 minutes for you. So you're going to save your stuff. So I'm going to save that care plan. Now this is very important too. Keep going in to save. Please provide a rationale for each intervention. So it won't let me save without a rationale for the interventions. So I may have to cancel it. Let's see. Let me cancel it. Now I'm going to save it. But I have to show you. Go to a saved care plan. Oh, I don't have a saved care plan. Okay, so I'm going to make something up really quickly so that I can show you guys something. Let's see, I'm adding my rationale. Okay, so here's my care plan, and when you're finished with your care plan, you have to go in and evaluate your care plan. So you're entering what you did on your shift, okay? And if I had written the related to and as evidenced by an expected outcome, it would all show up on the screen, but I was rushing. So you need to rate it and say whether it was effective or it was ineffective. If it was ineffective, you need to write a comment. Maybe patient was in too much pain. And then you're going to save that. So save was successful. Now you're going to finish, so you're going to do 3 care plans, okay? And when you have to do one for 106, I will certainly help you. And then you go up here and you submit your care plan. When you submit your care plan, or not care plan, when you submit your SimChart, it comes to me through SimChart, and I can grade it. And I can go in and I can write all these notes. They're in red print, so you'll be able to read what I write. And what I write will help you with your future care plans and your future SimCharts. So read it, print it, pay attention to it, and use my instruction for when you have a real patient. This is such a little fake scenario that you're going to be inventing most of it. It's just an exercise so that you know how to use this product for when you really have to enter data for your real patients. So come see me if you need to. I know this kind of slammed together to help you, but I really hope it helps you. Thanks.